Cardiovascular disease is a leading cause of death across the country. According to the American Heart Association, nearly 85 million Americans have some sort of heart disease. Heart disease causes 1 in 3 deaths in women. So what happens after someone has a heart attack? Well, many patients need cardiac rehab. So joining us is Lisa Dean from St. Vincent's Cardiac Rehab, and also John McFaul, a patient currently undergoing cardiac rehab. So I want to start with you. What led to your cardiac issues?
Well, I think we've all had experience with heart issues, and my high school football coach died in 1956. He was 43 years old, and my wife passed away at 60, and I became much more aware of the importance of good heart health as a result of those experiences.
And how did you know that you had heart problems?
I ended up in the hospital with pneumonia, and they said, oh, by the way, you've got congestive heart failure.
And congestive heart failure, that's something that really can happen to anyone. I mean, everybody at home needs to know that this is something that could happen to either them or one of their loved ones. Can you talk to us about how many people get cardiac heart failure and how people need to check up on their heart issues?
Well, typically, like in John's circumstances, they did an investigation while he was in the hospital and said, oh, well, you have additional blockages as well. And so he had the heart catheterization, and that's how they identified his coronary artery disease. So coronary artery disease is really the focus of our cardiac rehab program. And most of our patients come in with a history of having had a heart attack or had an open heart surgery, stents, and now we do accept patients with heart failure as well.
And how do people at home need to know that they need to be going to the doctor and making sure that their heart health is in check to make sure that something horrible doesn't happen?
Well, it's very important for preventative to know what your cholesterol levels and your blood pressure are, to keep those things under control. And if you're having any risk factors, like if you have heart disease that runs in your family, if you do have high blood pressure or hyperlipidemia, high cholesterol levels, those are important to know. And then if you're having symptoms, if you're having chest pain, jaw pain, shortness of breath, undue fatigue, any of those things can contribute.
How has St. Vincent's helped you through this?
Oh, I consider it a life extension. I'm positive that it's one of the reasons why I'm still here.
And talk to us exactly what is cardiac rehab and what's different about that compared to going to the gym?
Sure. Well, cardiac rehab is an environment where you have medical professionals that are overseeing your care. We supervise you by checking your blood pressure, your heart rate, and monitoring your heart rhythm while you're exercising.
And why is that important, really briefly?
Well, that's important just because, you know, typically arrhythmias happen when someone's exerting themselves. And so that gives us, you know, the ability to identify that and get the help that's needed if they're having some problems.
So glad that you're doing well and that you're having a remarkable recovery. Thank you so much for both joining us. February is American Heart Month, and if you'd like to know more information about heart health, you can log into our website, news4jax.com, and click on the Health tab. We'll be right back.